What's the difference between anxiety and OCD? And why does it even matter? Stay tuned. That's what's up next. Anxiety and OCD can seem super similar, and so a lot of parents say to me, Natasha, what's the difference? How can I tell? And why do I even care? Because isn't it kind of all the same thing anyway? Well, it's not, and we'll get into a little bit about why it's important, because treatment is highly, highly different depending on whether it's anxiety or OCD. Now, to muddy the waters even further, if you have anxiety, you have a higher likelihood of getting OCD as well, because anxiety and OCD both have a strong genetic component. So if you're genetically predisposed to anxiety, you might be genetically predisposed to OCD as well. You can have both. And in fact, a huge chunk of kids do have both. So you want to flesh out what is anxiety and what is OCD. So let's start with anxiety. What if you don't come back to school and pick me up? What if I have to talk to people? What if a bad guy comes and kills me in the middle of the night? What if I choke on this food that you're feeding me? What if I throw up and everybody stares at me? Anxiety lives in the world of what ifs, and kids are just unsettled and paralyzed with fear based on their anxiety themes. Anxiety's cousin, OCD, starts off very, very similarly. What if? OCD is all about doubt. You think that toilet seat has germs on it? What if I hurt somebody? What if my thoughts kill my family? Did I accidentally do something that might have harmed someone? Does the left side of my face feel tighter than my right side? If I eat from that plate, can I get cancer? Those letters, those words, they just don't feel right. I need to say them. I need to write them over again. I'm having a bad thought. What if I'm a bad person? What if I want to do bad things? OCD starts with an obsessive thought, not an obsession like, hey, I love Minecraft, or hey, I love that TV show, I'm so obsessed with it, but a really bad, ugly, obsessive thought that is an intrusive thought that gets stuck in the child's brain, and they can't get rid of it. So far, it's starting to sound very similar to anxiety. But on the whole, and not always, but on the whole, OCD obsessive thoughts tend to be a little bit more irrational and nonsensical. And that makes kids even more embarrassed and even more ashamed to tell people about them. And that's why OCD often goes undetected for years. If you don't believe me, watch this video that talks about all the signs that are misunderstood by parents and go undetected. So once a child has an obsessive thought, when they have OCD and not anxiety, they want to do something to find a little bit of relief. And so they want to do or avoid something, which equals a compulsion or a ritual. Sometimes parents will sugarcoat this and they will call it a habit, a quirk, or a routine. Children do these behaviors to find relief, and their OCD convinces them that if they do these things, that their worry, their obsessive thought, will go away. Unfortunately, that's not true. It's a vicious cycle. So the more they do these compulsions, the more obsessive thoughts they have, and on it goes. So the biggest difference between anxiety and OCD in general is that anxiety is just a worry and OCD involves some sort of compulsion. A lot of times this gets confused because the compulsion can be avoidance. And so if I want to avoid every shirt that's green because it reminds me of throw up, and so I won't wear that green shirt, and I can't stare at somebody who's wearing a green shirt, then that's OCD and not anxiety. They're very confusing because a lot of times parents don't pick up on that avoidant behavior. We think of OCD and we think they have to be hand washing, organizing, or neurotic, and that's not the case. Also, there's a lot of mental compulsions. So if I have a thought that says, I'm a bad person. Maybe I want to do something horrific. Maybe I want to kill somebody. That's moral OCD, also known as scrupulosity OCD. And if you don't know what I'm talking about, you can watch this video and I explain it all. But when I have that thought, I want to undo it. And so I might mentally do a compulsion. I'm not a bad person. Am I a bad person? Let me go through all of the behavior I've ever done in my entire life and see, I did this when I was 4. That sounds pretty bad. I did this when I was 7. Well, that was pretty nice. That's a mental compulsion. I'm mentally checking. So just like I might physically check all the doors and locks over and over again, which is a physical compulsion, I can mentally check if I'm a good person. That's still a compulsion. Or I might just go up to my mom and dad and ask them, hey, I'm having a bad thought. When I was 4, I think I stole some gum from your purse. Am I a bad person? No, honey, that's normal. 4-year-olds do that. Well, I just did a reassurance compulsion, and that is OCD. So it can be a little confusing, but you want to look at if your child is having an anxious thought and they're doing something to undo it. A lot of times if I am confused in my office, I'll say to kids, well, that must be a very upsetting thought. Do you do anything to make yourself feel better? Anxious kids might say, no, I just try to think of something else. Try to get my mind off of it. Go watch TV, I color. That's normally what I hear from anxious kids. Kids with OCD might say something like, well, I know it's kind of silly, but sometimes I tap 3 times, or sometimes I say this special magical thing in my head, and I think it makes me feel better. Or sometimes I have to ask my mom over and over again for reassurance, and then sometimes I feel better. That is more of an OCD response. So if you're in doubt and you can't figure it out, that kind of rhymed, go to a mental health professional. It is always good to be proactive. It cannot hurt. Go to a therapist and say, look, this is what's going on. What do you think? Because treatment will look different. And it's important to find somebody who understands not only anxiety, but OCD. If you have a child who has anxiety and you're not sure if they have OCD, find a therapist who specializes in both. And I know that can be kind of hard. You can go to the International OCD Foundation's website at iocdf.org/find-help, and you can find somebody in your area, hopefully. So why the heck does it matter anyway? It does, let me tell you. If I was treating a child for anxiety, then I'm going to do a lot of just basic CBT with them. CBT stands for Cognitive Behavioral Therapy, and I'm going to work on their cognitive distortions. So if a child comes to me and says, Natasha, I'm so worried, I think a bad guy is going to break in, then I'm going to talk to them and we're going to go and problem solve. In my therapy, I talk about red thoughts and green thoughts. And if you don't know what I'm talking about, I talk about this in my book, Anxiety Sucks, a Teen Survival Guide. And I also talk about it on my online class for parents called Teach Your Kids to Crush Anxiety. And so I teach kids to tackle their anxiety and to argue with those irrational thoughts and to come to their own logical conclusion. So if a kid is worried about a bad guy, we'll say, well, does that make sense? Are all the doors locked in your house? Are all the windows locked in your house? Yes. Has anything ever happened to you? No. So when you have that thought, what are the green thoughts that you can tell yourself to counteract the red thoughts? And I'll go from there. We're not going to get into it today because that's not what this video is about. But I will have a rational conversation and I'll teach them how to play detective and solve their own worries. Now, if it's OCD, I'm not going to do that because OCD tends to be completely irrational. So I might spend the first session talking about why germs aren't going to make you die instantly, but then I'm never going to go there again because the child knows that it's irrational, I know it's irrational, and we're wasting our time arguing with OCD because OCD doesn't care about whether it's rational or not. OCD is just going to want your kid to do the compulsion. So it's going to say, I know that you probably don't have bird poop on your hands, but just in case, why don't you go wash your hands anyway? And so me telling a child, honestly, how are you going to get bird poop on your hands? We're inside the house. It just doesn't make any sense. The child already knows that. And so they're not going to want to hear that from me. That's just going to make them feel embarrassed and uncomfortable. But if I say, OCD is lying to you, we already know that. And so what are we going to do about it? So as a parent, if you have a child with just anxiety, you're going to help problem solve. So when my kids are anxious and it's not an OCD issue, I will say, what do you need to tell yourself? And they will come up with their green thoughts. We are all safe in this house. Nobody can hurt us. The doors are locked. and that makes them feel better, and they go back to bed. If my daughter comes back out and she says, "Mom, I just had another anxious thought," this happens a lot. I think there's a monster in my closet. And I'll say, "What do you need to do with that?" "Okay, I'm gonna go in my closet, I'm gonna turn the light on, and I'm gonna check." "Okay, I'll be right here. Tell me when it's done." She'll go check, she'll come back. "Okay, Mom, I'm safe. Good night." Now that didn't happen overnight. There was a lot of training involved and a lot of skill building, but that's what we do. And she's fine. Now, if it's OCD, it's not gonna work that way. And so if you have a child with OCD, and your child says, "Mom, I just saw you wipe the counter down with that Clorox wipe, and then you didn't wash your hands, and then you got a bowl from the cabinet and you just served me soup in there, and now I think I ate Clorox and I think I'm gonna die." So that's an OCD thought, highly irrational, and the child is checking for reassurance, which is actually a compulsion. So if I were to say to my child, "Don't worry about it, honey, Clorox wipes are safe, and I didn't even touch your food, I just grabbed the bowl, it's not in your soup, you're fine," I'm not helping because I just completed an OCD loop. And if you don't know what that is, watch my video on how to not complete an OCD loop. And I'll also leave a link below in the comments on why it's not good to give reassurance to your child with OCD. So if that was my child and I already knew they had OCD and we've already talked about it and we've named it, and if you don't know what I'm talking about, hopefully you have a therapist who's helping you. And if not, I have an online parenting class called Parenting Kids with OCD. And I walk parents through this step by step by step so that you name your OCD and you educate your child on OCD. And once you have all that done, your response in that moment would be something like this. "Sounds like your O is trying to talk to me. I'm not talking to your O because we're going to grow it bigger. So I'm going to ignore that question and I'm not talking to your O." It would sound something like that. You would have already named it a cute nickname like O or dictator or O liar, whatever the name was, and you've already talked and educated your child on how OCD works. So they know when they're asking you, they're actually doing a compulsion and they're doing some checking behavior with you. So once all that is known, then you can reply in that way. You can't reply in that way until all that work is done and your child is okay with you replying in that way. But I want to give you an example of how it would vastly differ depending on whether your child had anxiety or OCD. So you're probably saying, "Natasha, what if my kid has both? Then what kind of response do I give them? How do I know when it's an anxiety and how do I know when it's OCD?" Well, it does get a little muddy, and that is true. But you want to really understand your child's anxiety themes and their OCD themes. And the main thing you want to hyper-focus on are what are your child's compulsions. And so you want to figure out, what does a compulsion look like for your child when they're asking for reassurance? And what does it look like when they're just anxious and they're needing some comfort? With OCD reassurance, the child is not satisfied. And so often they'll ask it over and over and over again. So that's a good indication. Also, it will be nonsensical. So a lot of times what they're concerned with doesn't make sense. And they know it doesn't make sense and you know it doesn't make sense. So it might be something like, "You know what? I think that I got some mouthwash in my eye. Is that dangerous? Can that hurt me? Can I die from that?" Most of the reassurance that a child is going to seek from you when it is OCD will be irrational. And so that is a pretty big indicator that you're dealing with a compulsion and not some regular comfort and reassurance. I hope you found that helpful. Next week, we'll be talking about how to know when to get some professional help for anxiety or OCD.